through case 9140. This is a case of an epidural hematoma. We'll talk about the findings and some of the pertinent secondary findings as we walk through this case. So as you can see here, this is a non-contrast head CT. We've got axial reconstructions in both soft tissue and bone algorithm, and then we've got coronal and sagittal reconstructions. So the primary finding in this case is a hyperdense, biconvex, extraaxial collection that's overlying the left frontal and parietal convexity. And there's also kind of a second area, which is down here overlying the left temporal lobe. So you can see that really nicely how this is kind of a bilobed, biconvex, extraaxial collection on these coronal images. You kind of got one hump here and one hump here. So this is a large epidural hematoma. It's exerting mass effect both on the frontal and parietal lobes on the left, as well as on the left temporal lobe. You can see that on the coronals quite nicely too. There's sulcal effacement within the left cerebral hemisphere. Here, there's a little bit of room in the sulci on the right that you can see, but here, see how the sulci, there's no CSF density in the sulci on this left side. You can see that there's compression of the frontal horn of the lateral ventricle here, as well as the body of the lateral ventricle on the left due to mass effect. And then there's midline shift. And just kind of a quick pro tip on measuring midline shift. We're going to use our measurement tool here. We're going to find the falx kind of where it attaches to the anterior portion of the skull and the posterior portion of the skull. We're going to make a line. And we're going to make sure we're at the level of the foramina of Monroe here, the lateral ventricles and the third ventricle right here. Where those meet, that's where the foramina of Monroe is. We're going to take our measurement and we're going to measure. And that's how we can get a nice, consistent midline shift measurement on every case. So there's actually 7 millimeters of left to right midline shift, or as we also call it, subfalcine herniation. So midline shift related to this large left-sided epidural hematoma, you can see that the basal cisterns here, right, the suprasellar cistern and then the quadrigeminal plate cistern, those are both open, right? They have CSF in them, but you can see that the mass effect on this temporal lobe is starting to shift the uncus, which is the medial most portion of the temporal lobe, over here into the suprasellar cistern just a little bit. Then as far as the rest of the brain goes, it looks pretty good. This is a young patient. But this is definitely one where the surgeons are going to want to get involved. This is a large epidural hematoma. It's presumably related to an arterial bleed. There's a very subtle associated skull fracture here that you can see on the bone windows. If you just kind of follow this, there's a line down here. There's this little extra line that's kind of a hairline, non-displaced, non-depressed fracture. That's super hard to see, but it's right subjacent to where the where that epidural hematoma is. So that's the associated skull fracture. This one's going to get surgically evacuated because of the degree of mass effect, and in all likelihood, it's an arterial bleed.